Good afternoon. On behalf of Health DNA and their media partners Mintline, a wonderful initiative has been undertaken, an initiative to create an awareness about diabetes in this month of November, which is celebrated all over the world as Diabetes Awareness Month. I'm happy to be contributing my part to this initiative to be speaking on women and diabetes. I'm Dr Arundhati Dasgupta. I'm a consultant endocrinologist based at Siliguri. So when we're talking about women and diabetes, the first question that would rise in your minds is, does diabetes behave any differently in women than it does in men? So diabetes, as you know, is a disease which is engulfing large proportions of people around the world. It is increasing every day at drastic proportions. If we talk about the incidence of diabetes, the incidence is not grossly different amongst males or females, and the risk factors or the symptoms, the complications are more or less the same. But there are certain areas of difference. For example, there are certain diseases amongst women, like polycystic ovarian disease, which predisposes a person more towards diabetes as compared to the male population. So if you have a family history of diabetes and you've got polycystic ovarian disease, then your chances of getting diabetes is much higher than in people who do not have polycystic ovarian disease. There are certain complications of diabetes which are a little more in females as compared to males. Number one, if you're talking about acute complications and infections, which is usually more common in the diabetic population because of the difference in immunity between them and the general population. Now, infection as such is more amongst diabetes, but urinary tract infections is more common amongst women with diabetes, particularly in the postmenopausal stage. This is because of some anatomical differences in the genital areas which predisposes a female patient or to urinary tract infections. Secondly, if we talk about the chronic complications of diabetes, one of the complications which is cardiological complications, heart diseases as a result of the macrovascular changes because of diabetes. Now that is a little more marked amongst females with diabetes. They are particularly in the postmenopausal state. And in the premenopausal state, what happens is estrogen has a protective effect on the heart. And in the postmenopausal stage, because of the differences in the levels of estrogen, this protective effect kind of wears off. And then it has been seen in studies that the incidence of heart diseases is more amongst female, and also the mortality rate is higher. Say for the same heart attack in a male and a female, the female would have a poorer prognosis in terms of survival and mortality and morbidity. Another factor which also plays a role in diabetes and women is the presence of depression. It has been seen that depression is much more common amongst females as compared to males, and depression plays a very strong role in the glycemic status of a person, because it tends to alter the sugar levels, and at times it can create havoc with the blood sugar levels. If we look at the part of pregnancy, which is a very important part of a woman's life, diabetes has a strong relation there. Now, we have to divide the groups of patients who might have diabetes into two groups. Patients who have had diabetes and are pregnant now, and patients who never had diabetes earlier on, have become pregnant now and have been detected to have diabetes. So the ones who have had diabetes from before and then they conceive, the risks are greater with them if they have not controlled their blood sugar levels well. So we need to bring the blood sugar levels to optimum levels in HbA1c to below 6.5 before a lady who is a known diabetic plans to conceive. Because otherwise what happens is, in the first trimester of pregnancy, when the fetus has its organs being formed, if the mother has high blood sugar levels, the organ formation gets affected. The fetus can have malformation in the heart, the kidney, the spine, etc. There can also be other problems like miscarriage, increase in size of the fetus, decrease in the fluid level, in the womb, hypertension and in the mother, eclampsia in the mother, preterm delivery, etc. So it is very, very essential that any female in the reproductive age who plans to conceive gets her sugar levels absolutely under control and then conceives. For those with gestational diabetes, that is diabetes which is detected during pregnancy and was not known earlier on, the risks are not that great as in the other group, but then again it stands. So it's very essential that they go to the doctor. First and foremost, they get themselves checked. An oral glucose tolerance test is done usually by the 20th to 24th week to find out if the patient has diabetes, because otherwise there might not be any symptoms. And if sugar levels are detected to be high, that they go to the doctor and keep the levels under optimal levels, either by diet control or, if required, insulin. Now, we usually give insulin during pregnancy because this is one medicine which is not going to cross the placenta and reach the fetus. It is again and again, I'm trying to emphasize this because we see a lot of people being very casual towards their sugars even during pregnancy, and the outcomes can be disastrous both for the mother and the child. If we look at another stage of women's life, the stage of menopause. Now, menopause again is a state where estrogen and progesterone levels, they have come down, and there is a difference in the body's internal milieu. There are certain other aspects which come in, depression being one of them, weight gain being the other, as a result of which, with the onset of menopause, we often see disturbances in an otherwise controlled diabetic patient. So that needs to be kept in mind during that phase. When we are talking about the treatment for diabetes, usually there is not much of a difference when we're talking amongst males or females, but there are certain medications which can cause higher rate of complications in females, say a group which can cause more infection in females, or another group which can cause bone loss in females, which we would not prefer in the postmenopausal age, and so on. So there are some differences when we're choosing the molecules for the treatment of diabetes. So these are more or less the differences amongst females and males. Okay, another area where there might be a little bit of concern is about the use of oral contraception. So is it safe or not? Yes, oral contraception, depending on the age of the patient, the presence of complications. If it is a diabetic who is well controlled, does not have any of the complications of diabetes, then there is no problem in using an oral contraceptive pill. But if the patient is a diabetic with any one of the complications, then it is preferable to avoid oral contraceptive pills, because estrogen and progesterone might have an effect on thromboembolism and other areas where we would not like to take a risk on this issue. Having said this, apart from these areas that we have discussed, otherwise diabetes amongst women is not grossly different than it is in males. So the targets are the same, the risk factors are the same, the complications are the same. But what is not the same is often the attitude towards the treatment. In our country, as in a lot many areas of the world, women are not given a priority when it comes to treatment. They do not take the priority for themselves. Also, they tend to just ignore themselves and look at the other members of the family and take care of the other members of the family. Get themselves checked less often forget to take their medicines. If socio-economic factors are an issue, then they tend to sacrifice on their medicines and take care of the rest of the family. So these are areas, of course, which are strong points when it comes to differentiating between women and men with diabetes. But nowadays the gap is diminishing. We are improving, the social outlook is improving towards women, so we are seeing better results there. So that is that, mostly on women and diabetes. If you have any questions, you can put them forward to my email address, which is drarundhatidg@gmail.com. You can also put it forward to my center's email address, which is rudrakash.sc@gmail.com. Thank you so much.